I'm Dr. Kerry Assil, and this is Ivy League. We've gathered some of the top expert doctors and surgeons in their field to come together and tackle some of the most unique and complex problems in modern medicine today. Kristen is a 32-year-old nurse who's having progressive nerve injury in her foot. Kristen is a busy nurse who's running around on her feet all the time, and she's pregnant. Kristen has tarsal tunnel syndrome. It's like carpal tunnel syndrome in the wrist, except it exists in the ankle. Every time she moves her ankle and puts weight on it, she's damaging tissue.
It's so severe now that by the end of a 12-hour shift, I can barely walk. The pain is mostly right here, and then it'll move all the way down the bottom of my foot and then around to the other side of my heel. It's caused by a bone that started growing out of the side of my ankle. I was scheduled for surgery, and then about 2 weeks later, I found out that I was pregnant. So I've noticed as I gain weight, the pain just keeps getting more and more intense. Obviously, having surgery while pregnant is not ideal, but being 6, 7, 8 months pregnant, being 30 pounds heavier, and just not being able to walk at all, and that's just not a good option for me.
This is really not a straightforward case. There's a lot of dilemmas that arise when you consider doing surgery on somebody who's pregnant. When I think of a pregnant woman having surgery, I always think of the effects of the anesthesia.
I think what we should do is do a block behind her knee with local anesthetic. She can be wide awake during surgery, but her leg will be numb.
2% of women end up having non-OB related surgery during pregnancy. As long as she's not in her first trimester and you're not using general anesthesia, we're safe.
My other concern is that we're going to need to use a tourniquet.
These patients are at risk of forming blood clot in their legs. I definitely recommend using a blood thinner for the first 2 to 3 weeks post-operatively. On the day of surgery, I can do an ultrasound before, during, and after the procedure.
Excellent. Sounds to me like we got a plan. You're going to be there to monitor the baby, and you guys have your arms around secondary issues such as potential clots and blood thinners and so forth.
Kristen and her baby-to-be met with the Ivy League to come up with a plan that would be safe for both her and her little one. Let's see what happened in the OR.
The goal is for us to get you up and going as quickly as possible.
Okay, well, let's do it.
We want to be as safe as humanly possible since she is pregnant.
I prefer to do her case under regional anesthesia because the medication used in general anesthesia can actually cross the placenta and affect the fetus. They have a great heartbeat and they can start with the procedure.
We're actually going to use a nerve block to prevent pain from going up to the brain.
She's only 14 weeks, so later on in pregnancy, there's more risk of preterm labor and uterine irritability at the time of surgery. So this is the ideal time to operate on Kristen.
So first thing we're going to do is free up her nerve. You can see how tight it is on her. So she's reading 851 for the nerve. We want to see that number going up. I'm going to basically take all these ligament strands and I'm going to free it up slowly. You're up to 2,600 now. So this is right where her pain is. It looks yellow and it looks a little bit thickened. We want to make sure that that nerve is not getting squeezed, pinched, or irritated in any way. Now it's time to sew her up and get her out of here.
Kristen, I'm going to monitor the baby one last time just to make sure. He's doing great. Excellent. We're done with surgery, the baby's doing great, and we're going to take her to recovery.
Please welcome Kristen and her physicians, podiatric surgeon Dr. Bob Baravarian and OBGYN Dr. Aliabadi, along with the ringleader of the Ivy League, Dr. Kerry Assil. And great job, as always, docs, putting the treatment plan together, acknowledging that a pregnant patient is very different than a non-pregnant patient. How are you, Kristen?
I'm doing great. Yeah, the surgery went really well.
So, out and about, walking around, feeling good?
Totally out and about, walking around. I went back to work 3 weeks after the procedure. I'm able to hike. I haven't started jogging yet because this just keeps getting bigger, but other than that, I'm fantastic.
And Dr. Aliabadi, it sounds like by you working with the rest of the team, you really were able to ensure that nothing would happen to her.
Absolutely. I monitored her during and after surgery, and they both did really well. And I was really happy to find out that he was able to do the case under local anesthesia.
That's what struck me watching the tapies, that was brilliant to go that route, and I'm just so happy you had a great outcome. Dr. Steele, once again, bringing the dream team together.
Thank you. Thank you, Travis.
And this is the Ivy League, folks, with one happy patient. Kristen, best of luck.